On today's show, we'll discuss improving Africa's immunization outcomes. As always, you can join the conversation with the hashtag #BeyondMarkets. You can follow my Twitter handle too at Esther Ubudaga. Now, according to the World Economic Forum, 1 in 5 African children still do not receive life-saving vaccines. In 2014, 42% of all global deaths from measles, a preventable disease, were in Africa. However, Africa only makes up about 17% of the world's population. Although progress has been made, more still needs to be done to improve immunization on the continent. With Dr. Awele Elumelu, CEO, Avon Media Practice and GAVI champion for immunization, joins me now for this discussion. Dr. Awele, thank you so much. Pleasure to have you on the show today. Quite sad. I mean, I know that we've made a lot of strides as far as vaccines and immunizations are concerned, especially in Africa and particularly also in Nigeria, even with our population. But when one looks at some of the numbers for some of the, even polio, for example, I mean, I thought we dealt with that, but then it came back again, and measles. Exactly. And I'm thinking to myself, what is it that we're not doing? But to provide some context, help us understand the state of immunization in Nigeria.
Okay, so basically the global goal is to achieve like a 90% coverage of immunizations. That is to make sure that you have 90% of the children who receive at least the 3 complete doses of the DTP, the diphtheria, the tetanus, and the polio, diphtheria, the tetanus, and the pertussis vaccine. In Nigeria, we are barely over 30%, and that's the national average. You still have it as bad as 2% in some areas in the north, and a lot of states are still under 10%. Fair enough, some states are maybe 70% or thereabouts, but you don't have any state that is actually more than 80%. So no state has actually achieved the global goal, but as a country average, we're only about 30%, which is quite bad.
So what would we say? I mean, I imagine that some investigations have been done. What would we say, what would you say are the key barriers to achieving a higher percentage of coverage?
So one of the main things we would find is a study that was done in 2016, and mind you, that was the first time we actually had a detailed study done with detailed data. One of the issues we've even had is even getting accurate data. So in 2016, under the chairmanship of the new executive secretary of the MPHCDA, the survey was carried out, and then it was found that most of the states are in the north. So what do we have? We have barriers like lack of education of the mothers. So our mothers are the ones who look after the children. We have barriers like lack of trust for immunizations and for healthcare facilities. I'm sure we've heard a lot of rumors where it's
belief systems and all of that,
exactly,
religion and all of that. Yeah.
Exactly. So there's so many things there, and then we have issues with even the human resources, the staff. We don't have trained staff who are able to carry out all that they need to do. We don't have the staff who are able to actually gain the confidence of the people they're actually trying to convince to come in for immunization. So we have all those. As well, we have things to do with even the supply of the vaccines. We don't have good cold chain system to ensure that we're maintaining our vaccines as we should. So there's quite a lot of issues that actually prevent us from achieving what we should be achieving. Not to talk of even the conflict areas that we all know that we have. That's contributing as well.
Compounded issues. Yes. So I'm thinking, because the first point of call is the primary healthcare centers. Yes. Many of them in remote areas, apart from even the beliefs, just having that is strong, that functional, as it were, primary healthcare center. And I'm thinking at that level, that's under the state, at least there's the state, we have a state government and a local government who are closer to the people. Yes. And I'm thinking, are they not empowered enough? Because when I hear the likes of the WHO and some other agencies, not-for-profit agencies who collate some of this data, who have actual contact with these people, and I'm wondering to myself, where's the missing link?
They're not empowered. So we have, funding is a big issue in the country, and it starts at the national level and trickles down through the state levels to the local government areas. There's poor funding for health and immunization in particular. Yes, we know that a few weeks ago there was approval for 1% of the budget to go to healthcare, which is commendable, but there's still a lot of work to be done. So we need proper funding, and funding is the baseline for it all, because without the funding, it's difficult to put the structures in place. Without the funding, it's difficult to educate the people who are actually doing this work.
What about donor? Don't we have donor funding? Or is that, well, that's not significant?
It's not significant enough. So you have donors who come in, but a lot of them, first of all, so apart from even the donor funding, you need the structures, you need the governance. So a lot of these donors you will find want to work with the government on ground. They don't come in and actually take over the work. They're not the ground, so they're not the foot soldiers. So we need government's input. We need government to put the right structures in place so that when these donors come in, they have a system with which they will work and operate to be able to deliver the immunization that we need. Okay,
so how do we proceed? How do we move forward now? Because I was looking at some WHO statistics, and funny enough, it's not even just Nigeria. It's actually globally. You're looking at some statistics where they say global vaccination coverage is stalled at 86%.
86%, yes.
2016. So it would appear that we've had this momentum over the decades, over the years, and all of a sudden it's slowing. Why would you say it's? What do you think? Why would you say it's slowing down?
Well, one of the reasons actually for this stall, as we would say, is when these donor countries or donors come in, there's usually an arrangement. It's not in perpetuity. So you find that they have arrangements whereby the countries are carried along, the countries are supported until they achieve a certain economic status. So you find that as countries get into the middle income status, the support is pulled away. So sometimes you find these countries have not actually, they're not ready for it. So there are a number of African countries who have achieved such status and have had the support pulled away, and they're not ready for it. So you find that they've achieved a certain percentage of coverage, but that starts to decline once they lose this support. It's, at the end of the day, it's still the countries. The countries have to be committed.
So it's a matter of
priority. You have to have that political will, yes, yes.
And I'm thinking, how do we solve the issue of priority? Because what's important to you, I mean, you make it a priority, and if you know that it requires additional funding, then you get the funding, and then you get the desired result. So how do, I mean, the stakeholders, what can we begin to do? Because I know that now there's a big push for the private sector to get involved. At least let's get some private sector capital into this. What are your thoughts on that?
Yes, so we have to continue to rely on advocacy to get the government more involved. But, as you say, the government can't do it alone. The private sector is equipped. They have the ability, the know-how. They know how to manage systems, well, I guess we should say a bit better than the government, but we still need the government. So I think the partnerships are very important. For example, we have a clear example, GAVI, the GAVI of which I'm the ambassador in Africa. This is a perfect example of a collaboration between public sector and the private sector. So they're an alliance made up of like the World Bank, the Bill and Melinda Gates Foundation, the WHO and UNICEF.
Some of the people who are already involved in the immunization process. Okay.
But they also work with governments. They have some donor governments. They work with different organizations and ensure that, you know, they bring together all the players, so to speak, to achieve what is necessary. They have a number of, I'm just trying to think of some partnerships that they have, to give you an example. So sometimes they partner with even things like, they have this partnership with UPS, where somewhere in Tanzania, where they partnered with them on delivering, using drones to deliver immunizations, deliver vaccines.
In remote areas.
In remote areas. So they have a number of, in GAVI, there are a number of such partnerships, which are very important. There's also the financing partnerships, the IFFI, so it's like international funding partnership, whereby they can actually buy stocks on the capital market, but these are backed by long-term donors. So there's a lot of innovative ways that GAVI is trying to fund most of this work that's needed to be done.
Okay, let's quickly talk about, because I'm also thinking to myself, where does that leave the Global Vaccine Action Plan? We're meant to achieve that by the year 2020. That's just, what, 2 years away?
A few years away.
We're in 2018, two years to go, and the plan is to get millions of children vaccinated, and of course bring down those numbers. And I'm wondering to myself, where does that leave us? How do we get that begin to get that momentum?
It really is a problem.
Does it now lie mostly now in the hands of the private? I know you've said that, I mean, we have the support of the government, but would you say that now, because of issues like poor funding and maybe a bit of misplaced priorities, we need to now put more pressure on the private sector? For sure. Global Vaccine Action Plan, fantastic initiative, but then it's still a problem. Most of the other countries in the world were able to achieve this, but we find that only about 36% of African countries were able to achieve this. So again, we still need the private sector to come in
to help us to achieve this, so that we're not lagging behind, so that we're not falling short of the achievements we've set as a global community.
How about putting more pressure on the government? We've talked about, GAVI, and it's also an advocacy group. How about putting more pressure on the government? Because this is not just a Nigeria problem.
No,
but unfortunately, when you look across the countries that have these problems, many of them are developing nations. Yes, many of them are, per capita income, poverty, high poverty levels, some in conflict. So, but then at the end of the day, one still has to hold those governments accountable. So would you say that on the advocacy side of things, we need to step that up? Who can begin to lead that charge?
I had mentioned that, yes, we need to really continue this advocacy issue because we need the government. So we already have people like all the donor companies and donor associations, the GAVIs, the MPHCDA, trying to apply pressure. But it's not enough. We can only continue. We have to continue to try to apply that pressure.
The governments are not listening. The body language is just not right yet.
I think the problem is they don't understand
your experience. What do you see?
They haven't truly understood the importance of a properly functioning health sector. I think that's the problem. And until they come to understand and appreciate the need for that sector, there's so many, we understand that there's so many things the government has to do. But the government needs to understand that a healthy nation is a wealthy nation. And until we learn to lay emphasis on the health sector, we won't make much of a progress. So I think that's the main thing. The advocacy has to continue, the pressure has to continue in the belief that someday enough attention will be given to the health sector.
But in Nigeria, would you say that because we've spoken for the African continent, but for Nigeria, would you say that advocacy, we have momentum with advocacy?
Oh yes, I would say so, because as I said, just last week, we had this 1% of consolidated revenue being approved for health. So, and I did say that was that was highly commendable. Yes, it was. So at least we're beginning to see results. And we're hoping for more like that. So I think in Nigeria, advocacy is working, but we still need to do more. Yes.
So as a GAVI champion, let's talk about that in depth now. You were named a GAVI champion in January. Tell us what I'll use the word portfolio. Tell us what your mandate is, what you're expected to do, and how you're going to get that private-public sector partnership to get this, to give us better numbers, as it were.
Okay. So first of all, it's basically to continue to create the awareness for the need for immunization. So now in my own personal life, so not as a GAVI champion, I myself am a medical doctor. I'm a CEO of Avon Medical. We have a health insurance company. So in our own way, we're already playing a role in the health sector, playing a role in achieving universal health coverage. But in addition, I'm part of a bigger group. So we have the Earth Holdings Group. Now, as a GAVI ambassador, automatically it means that our whole group is involved. I mean, we're involved in healthcare already. We're involved in different sectors of the economy. And through that, we're already looking at ways in which we can also work out innovative ways of supporting the work of GAVI.
Take a quick break and we'll be right back with the rest of the show. Join us again. Still with me in the studio is Dr. Awele Elumelu, CEO, Avon Medical Practice and GAVI champion for immunization. And we're continuing the discussion on improving Africa's immunization outcomes. Dr. Awele, thank you so much for your time so far.
Thank you very much.
We're talking about GAVI and we're talking about some of the innovative ways to get both the private and public sectors to join in the I won't say fight, join in the move to get those numbers up. But let's talk about GAVI's 5-year strategy. I know 10 million children, African children, or in the GAVI, countries where GAVI is present, to have those children immunized. Tell us about that.
So GAVI was set up in the year 2000, and then between 2000 and 2015, the mandate succeeded in immunizing 500 million children, and in essence, preventing about 7-8 million deaths. 2016 to 2020, there's a strategy that has been set up by GAVI. And in this strategy, the plan is that a further 300 million children will be immunized. And then, in that, we're preventing another 10 million deaths. So that's the plan. The donors at that 2016 strategy agreement brought together $7.5 million towards this. So that's actually a strategic plan. Now, about halfway through the plan, a total of about 640 million children have actually been immunized, and about 9 million deaths have been prevented so far. So GAVI is well on the way to achieving that target that was set in 2016.
Well, let's digress a bit. I wanted to talk about polio. Okay. We mentioned polio earlier. This was something we were able to completely eradicate, yes, but then for some reason it came back. Now I've heard experts say that sometimes it's imported, because people move about, and then you bring in a child or a family, and then they're infected, and then it spreads. But I'm thinking, how do we, when we eradicate a disease, how do we ensure that that disease does not come back, even if we can't stop people from traveling and moving about?
Simple. We have to make sure we continue with our routine immunizations. We must make sure we carry on with these. So yes, we said we had eradicated polio, but one factor, as you said, is travel. We never know we live in a global village now. So if we don't maintain and keep up our routine immunizations, we're always at risk of all this happening again. So a lot of people will say, oh, I'm fine, I don't need it anymore. But that's not the case. You must continue this immunization. There's something called herd immunity. So if we don't have enough people that are covered, that are immunized in a community, it puts everybody at risk. So we must always have a certain number that's fully immunized to make sure that everybody is safe from these diseases.
So tell us the work that you're doing, right? Let's go back to GAVI. Tell us about the work you're doing right now since you became a GAVI champion. What have you done so far? What are your targets, I don't know, for the year, 2 years? How long are you going to be a GAVI champion?
Okay, so the GAVI championship, what we've done so far, basically, as I said, the aim really is to increase awareness, to get the word out there, as well as to try and garner more funding. So through platforms like this, and working with the NPHCDA, which is the National Primary Healthcare Development Agency, we're able to get messages out there. We're able to go out to educate people, to let them know that this is important and that they need to do this. There's also the funding aspect. So working with GAVI, we're in talks. As I said, I'm part of a bigger group, as Holdings. So we're in talks with GAVI on how we can arrange funding for immunizations to get better coverage of immunization. GAVI is also in talks with a bank like UBA, United Bank for Africa. They're really in talks. I couldn't give you the details now because they're still in talks. So they've not been concluded yet. And once this has been concluded, it will be rolled out. Also, all in a bid to increasing funding. Having said that, we also have a foundation, the Awele Elumelu Foundation. The foundation primarily is a 10-year, has embarked on a 10-year project to fund and mentor 10,000 entrepreneurs all across Africa. There's a promise of, there's a $10,000 that is available to each of the entrepreneurs. It has gone on for 3 years now. So we have technically 3,000 entrepreneurs, Awele Elumelu Foundation entrepreneurs. So the plan is to work with these. And of these, we already have about 10% of them that are in the health sector. But we don't need only those in the health sector. So part of the plan is to work with these entrepreneurs in the different countries. As I said, they're spread all over Africa. So to work with them to see how to get the message out there on the importance and the need for immunization coverage.
Okay, so for your work as a GAVI champion, what are you hoping to look back on and say, okay, this has been my legacy, this is what I set out to achieve, and I achieved it?
It's those numbers. We need those numbers to go down or go up depending on what direction you're looking in. So coverage to go up, deaths to go down. So I would be extremely happy if we achieve and even exceed those numbers that we've set for ourselves. It's immunization. It's one of the cheapest ways to prevent childhood deaths. We're all mothers. We have our children. We know what it is to lose a child. But we know also that a lot of these deaths are preventable. So for me, that would be it. To achieve those numbers and even exceed them at the end of my own tenure.
Okay. Are there partnerships with the companies that produce these vaccines, these drugs, to get, perhaps it could be produced cheaper, at a cheaper cost, and, in larger volumes?
So cheaper to the community, yes. So there was the first example I gave of, I'm not sure if I mentioned it, of the advanced markets commitment. Okay. So in this one, GAVI has an arrangement whereby they've incentivized, they've raised funds, made some available to these companies to produce these vaccines, and so this come to the communities at cheaper, lower prices. There's also another arrangement that GAVI put in place. This was following the last Ebola outbreak in 2016. This is the advanced purchase commitment. Okay. So GAVI made an arrangement with Merck, the pharmaceutical company, whereby they had agreed with them that Merck should go ahead and produce vaccines. And once these vaccines were, you know, Ebola, we all know about the Ebola crisis. So this was research into the production of Ebola vaccines against Ebola. So the agreement was for Merck to go ahead, research and produce these vaccines, and whenever they're available, GAVI would pay. So this is the agreement that was put in place in 2016. Right now, there are 300,000 vaccines available, which are actually currently being used in DRC. As we know, there have been some reported cases of Ebola in DRC. So these are currently actually being used in DRC, these immunizations, these vaccinations, sorry.
Okay, so if we're able to get cheaper vaccines, and but I'm also thinking about those areas, especially in the northern part of the country where we have the higher figures, access to those remote areas. How are we dealing with access to those remote areas? And for areas that are still in conflict, are those areas going to remain off limits until we're able to find a way to get through to them? Well,
as I said, it's a challenge. I mean, one of the ways in which I know the government found a way of getting to those conflict areas was in this, they come up with this hit and run strategy, where they would, early in the morning or later at early hours of the day, they would go in, immunize the children, and then quickly pull out before daybreak. So, I mean, it's things like that. We can't say we will do absolutely nothing until the conflicts are over, but then we have to find ways. There are also times where you have, like, I know in the Muslim communities, at times where they have certain areas, maybe the prayer time, where there will be an agreement. You know how you have all these truces.
Okay.
And then the health authorities, the Red Cross, and all the different organizations can go in at those times, immunize, and come out. We have to just keep trying in whatever way we can.
Now, for the belief systems, because I'm thinking that sometimes speaking to the elders, the community leaders, the chiefs, you know, heads of the communities, speaking to them or trying to reason with them, is that also an approach that's been explored?
Oh yeah, it's been done. Not only being explored, it's actually been done already, because if you can get the leaders, you know, as you said, the belief system, if you can get the leaders of these religions to buy in, then you stand a better chance. In the same way, along those same lines, we're working more closely with women, because you find that if you, and we're actually trying to train more women, because you find, especially in the north, a number of people will only go to a female carer. So there's more focus being placed on training more female health workers, and also even getting the women in the community, training them, educating them so that they themselves can pass on this information to their fellow women.
Okay, now, not so long ago, we had a conversation, especially when Bill and Melinda Gates, when Mr. Bill was in the country, and they talk about human capital development, placing priority on healthcare on the one hand, and of course, education. So for you as a practitioner, when you look into our future, when you look into the future of Nigeria, with the rate at which we're going, not having enough momentum, funding issues, and all the challenges and barriers that still hold us back, even though we're trying to tackle most of them. How worried, how concerned are you about the kind of population that we're going to have in the future, the workforce population, and the health of the population?
It's very worrying, because the population is growing at an extremely rapid rate. All the support systems are not growing. Either they're not growing or they're not growing at a commensurate rate. So it's very worrying. Good thing is, with the health insurance that has come up now, it also makes it possible for people to have a bit more access to healthcare. But we know that area has to be, the structure has to be improved. There's a lot of work that needs to be done. Anyway, as I said, it is worrying. But we're seeing efforts being put in here and there to improve.
Because the way I see it, I'm thinking to myself, if we look at the numbers as they are today, I mean, many of them still quite abysmal, isn't it easy to plot and say, and if we keep up that pace, that slow pace, that, pace, and isn't it easy to plot and say, okay, this is what, if we keep up with these numbers, this is going to be the outcome in the not too distant future, 10, 15 years from now. This is where we're going to be, a country where we still have children, maternal mortality, children under 5 being malnourished and not, having fully developed brain systems, as it were. That's where I'm going with this. Is that what? So when I ask you, when you look down the line, is that what do you see? Is that what you see?
Oh, for sure. If nothing is done, that's what we see. That's what we're already seeing. I mean, we know that, as you mentioned, infant mortality, under 5 mortality, we know that ours is higher than a lot of Western countries. Okay, maybe we don't want to go into Western countries, but where under 5 mortality is still in the hundreds per thousand. That's not good enough. So we're already seeing it. If we don't do anything about it, we will continue to see much of it. It goes without saying. So we need to do things. We need to improve the health system.
I've also heard that at some point there will be donor fatigue. Because, I mean, yes, we appreciate the aid. We need the aid. We hope it would continue, but I'm thinking that won't always continue. And there's been a lot of talk and conversations about donor fatigue. So I'm thinking if that comes out of the equation and we're still dealing with priority issues, I mean, I'm not trying to be a doomsday.
No, it's true. You're right. Because even without donor fatigue, the whole donor programs are usually structured. So even without donor fatigue, they are structured to exit at a certain time, which is why we keep saying government has to take ownership, because the donors will not be there forever. Government has to take ownership, but as we've also said, the private sector has to rise up and support government. Okay, so it has to be a partnership. The government has to be there, the private sector has to be there, because the donors will exit, fatigued or not, planned exit or exit due to fatigue, exit is for sure certain.
So I guess we just hope that, I mean, leaning on the private sector now, going forward, that we can, you know, get more benefits from that and hope that the private sector can come through.
Yes,
perhaps better than the government.
That's what we have to hope for.
Thank you so much, Dr. Awele. We're going to have to leave it there. Thank you for talking to us.
Thank you very much.
Having you on the show. That was Dr. Awele Elumelu, CEO, Avon Medical Practice and GAVI champion for immunization. And we'll be looking at Africa's immunization outcomes.